Thank you very much for the opportunity to speak today. I recognise lots of faces and some new ones as well. So my name is Baid and I'm based in the School of Sport and Health Sciences, which is across the motorway in the Falmer campus at the University of Brighton. And my background's in intensive care nursing. My main job is teaching the intensive care nursing course, but collectively over time I'm doing more and more teaching and research in the field of sustainable healthcare. And I've only seen this pie chart once. I thought, oh well, there'll be 4 times this pie chart comes up, because often it does in any kind of sustainable healthcare sphere. And I just wanted to link this to the education. And the ethos of today's event is about this partnership and research. And for those of us that are involved on the teaching side of things, we would love to do more of this. Similar to, I can't remember who said earlier about clinicians not knowing quite what to do. Teachers don't know what to do. We weren't taught this. I wasn't taught any of this in my nursing education or my intensive care nursing education. So where do we start? And I would argue that most educators don't even know there's a net zero report, don't even know that this is statutory requirement in this country. This is a legal requirement to embed climate change into healthcare practice or climate change improvements. And so what do we do about that? And so there's a huge need to do this quickly and urgently. And how do we go about that? And locally we've been trying to do that in a number of ways, which I'll share with you. And I was asked to come and speak at the World Health Organization 5-yearly ministerial conference on environment and health that meets every 5 years. It's linked to the COP program. And traditionally I think it's focused more on the public health and adaptation side, but they're now starting to address mitigation. And they have this new environment and health process partnership, which a number of countries have signed up to, including the UK. And so for those of us that were speaking, we're allowed to stay for the rest of the event. And what I was listening to throughout, I thought really fit what you're talking about today is around partnership and how nobody can do this alone. And that there's a real need for more collaborative research and then translating that research into evidence-based practice through education. In higher education, many of you in the room I'm sure will be aware of the Advanced HE and QAA strategic guidance that all universities, all courses, all subjects, no matter what you're doing, we should be addressing the Sustainable Development Goals in some way. Otherwise, the education you're doing isn't fit for current societal needs. So we have a kind of equivalent of greener NHS requirement in healthcare. We have that statutory requirement or strategic requirement in education as well. And locally we're very lucky in both schools, School of Sport and Health Sciences and Brighton Sussex Medical School. We've been doing a number of things over the years in embedding sustainability through various initiatives and groups and working together between the schools. And the Association of Medical Education in Europe defines education for sustainable healthcare as the process of equipping current and future health professionals with the knowledge, values, confidence, and capacity to provide environmentally sustainable services through health professions education. So future, Mood mentioned this earlier around how the medical school is embedding this into the curriculum, and the Medical Schools Council came up with some recent guidance on this. I don't know if Anna's here today. I'm not sure if Anna Jones is here, but for all the BSMS colleagues will recognize Anna's name. She contributed to this. And although this was written by doctors and primarily for medical schools, so much about sustainability is transdisciplinary. And so for other health professionals in the room, if you're involved in education, I really recommend having a look at it because it's just as relevant for any of the healthcare professions and provides a starting point and lots of links for, if you don't know what to do, here's a good starting point. That's the future generation. But what about the entire workforce? Isn't the NHS one of the biggest employers in the world? How many millions and millions of people need formal as well as informal education? It's an almost overwhelming amount of work to be done there. So Mood mentioned that we've set up a new module that we've just run for the 2nd time, and the medical school is going to be building on that to provide an opportunity for a whole postgraduate certificate in sustainable healthcare. And that's great for those that are doing very specific postgraduate education, but I also think there's a massive need for education of everybody, essentially. And what we're trying to do in other postgraduate courses and modules is actually just using a sustainability lens on everything that we do. If I give you a live example, I'm actually supposed to be teaching right now, but I told Mood I would do this. So I've given my students an activity because they're on the other side of the motorway. So they're working on an activity now around sedation. They're intensive care nurses. And the way I was taught was give as much as possible, just make them sleepy because the ventilator doesn't alarm so much. That's the way I was taught. Right? No, that's not very sensible. One, quality care, you have more delirium, it's not good for patients. And none of this sustainability work should be at the expense of quality care. But also, it's expensive. And we drop a lot of drugs in intensive care, never use them, or only use a part of a syringe and things, so we throw it out. That's the traditional way of teaching, it's the way I was taught, because you might need it. You're critically ill. What about that just-in-case thinking? And actually a theme throughout all the presentations this morning has been about clinical decision-making, isn't it? And education is taking that evidence-based practice and saying, how do we make decisions that are evidence-based in coming out with some kind of quality care at the outcome? But we haven't been so good about thinking, for a while we've been thinking about health economics and financial. We haven't been linking that to environmental sustainability. And of course there's social sustainability as well. So my students right now, I hope they're doing it anyways, I gave them strict instructions. I said I'd be back at 1 o'clock. They're working on a scenario, and I'm getting them to think about that less is more. Yes, you're going to need sedation and analgesia because actually, if you have a tube in your mouth, it's not very comfortable, you're critically ill, you need it. But that Goldilocks principle of not too much and not too little, but just the right amount. And that's really hard, because that's about teaching people what not to do, as much as teaching them what to do. And that's not been the ethos, especially in intensive care, when we're pretty good at using lots of stuff. So that whole idea of how do we go about that then, and how much research is actually needed to drive that. The students are really leading the way on this. I don't know how many people are familiar with the Planetary Health Report Card. I don't know if there are any students here today. Is this more other people? I'm just looking around if there's any BSMS students who might have been involved in this initiative. And it started with medical students, I think in San Francisco. And it was really successful, and it kind of spread across the world. And you're very lucky to have one of the BSMS, I think he's in his final year, called Jim Lee. He's on the international group that's organizing and leading on this initiative. So it was set up by students, it's for students. And essentially, these students were saying, we're really concerned about climate change, and we're not being taught any of it in our medical education. Why not? So I think there's a really powerful voice there in the students saying, we want this and need this, as Baid was saying. And so they develop criteria where they evaluate their own institution. And I just had a quick look before I came out to see how BSMS came out. You were originally B-, a couple years ago, moved up to a B+. So I'd encourage, if anybody's working on research, because one of the criteria is interdisciplinary research. How do the students know that you're all doing this in the local area if they're not somehow connected to that? So Anna Jones is the academic lead on this for anybody in BSMS, and anybody from School of Sport and Health Sciences. COTs, we're doing a OT version for the first time this year. Physios did it for the first time. We've done nursing for a few years. So it started in medical schools and it's moving across. And it's just a really great opportunity for collaborative partnership with academics, students, and looking at education, research, campus-based procedures. And the students can work together on this as well, and so they can learn from other disciplines. And then they come up with a report on how well they think their own institution does. So let's see if we can get BSMS up to an A, because the nurses got an A last year, just saying. And it's not a competition, it's about doing what's right for the planet. And these are some of our nursing students that were on a sustainability placement. So like all healthcare education, you can learn it in the classroom, but you have to actually do it. And it's quite common in all healthcare professional courses that you've got practice in community and hospital settings. And during the pandemic, when quite frankly, it was just a real crisis around where are all these students going to go. And the nursing team were looking at really innovative and creative ways of trying to find alternative placements. And I said, what about a sustainability placement? And it was really evaluated highly, so we're doing it as a rolling program now. And they're doing things like waste audits, looking at sharp spins. I don't know if you can see there's not a lot of sharps going in the sharp spins. There's gloves, there's packaging, they found coffee cups, pens. So the university is paying to burn coffee cups. Cardboard boxes that people had must put a lot of effort to shove into the sharp spins. That's a year ago. We've done a big drive that's been led by the students, and we've improved a lot. There's a huge amount of financial savings as well. Because of course we've been teaching in the classroom for some time, but if you go into the simulation rooms and we're not doing it, then it feels quite hypocritical as an institution. And we've been collaborating with the medical school and the technicians on both schools around making some changes. And not many universities are doing that, so it's a real opportunity. So just in summary, these are some feedback points or special interest group in sustainability in the School of Sport and Health Sciences gathered a year or two ago, looking at what's been enabling us to do so well, but also what are the challenges. And I've just put in bold the things that I thought really fit the ethos of your event today around there's so much local research and expertise. How lucky are we to have Susie and her team up the road at the top of the, near the race course. There's nowhere else in the world that has a Care Without Carbon team. The amount of research that's going on that Chantal and others have shared, and the international leading research and Mood's work and others and colleagues. And in the School of Sports Sciences, I've been working here since 2007. And we all kind of stay in our little bubbles. Once I got into the world of sustainability, I'm like, hey, I've got colleagues in my own institution that are experts on design for sustainability, on waste management, on material science. And it's been a really fascinating discovery of just how much internationally leading local expertise there is. So I think that's fantastic, and we need to celebrate that. And it provides a real opportunity to address the challenges around there really is a minimal research. We're novices in this area, and we need to have more evidence base to then guide the education that we're doing to enable clinical practice. So just to mention a couple of events, the Association for Simulated Practice in Healthcare has their national conference in Brighton on the theme of sustainability. So if you're into simulation, you can check that out. Mood mentioned the SHARE conference. Please come along. It's 25th of June next year. It's online, it's free. Great opportunity for students to present their projects. And he also mentioned about networking and the Centre for Sustainable Healthcare, which is based in Oxford, but they work quite nationally and internationally. They've got an online network that's a real opportunity for researchers to either disseminate their work or to seek help and things for research. Thank you very much.
Thank you. So just to make you aware, actually the UK government has recently announced some funding availability for sustainability. So just to make you aware, we will be putting together a bid because we would like this to be a national centre for delivering sustainable healthcare, and I think we definitely need to have some more conversations about how we link up with other organisations such as Care Without Carbon and perhaps at the ICB level as well.